About 11,800 patients, on two sites. We've got 7 doctors, so slightly different to Alan Dow's practice. When I first started, I started in 2000, and really we would have a GP surgery and we'd refer patients to the hospital mostly, and there were some community services, but most patients either got treated in the practice or in the hospital. But what we've seen over the last 15-20 years is that there's been a massive improvement in the acute care. If you're having a heart attack or a stroke or whatever it is, the chances of survival are going to increase quite a lot. The problem though is that you're going to be treated by the hospital, discharged back into the community, back into your home, and then you're living with your heart disease, your stroke, or whatever else it might be. And so one of the things that we've learned over the last 15 years is patients are saying, do I need to keep going back to the hospital, or can I continue to live and get the treatment that I want closer to home in the community? So I'm just going to describe what we've done in diabetes care over the last 2-3 years, because I think that gives a pointer to where we're heading towards in other areas as well, good or bad. But I'm going to share you what our experience has been. So traditionally, if you had diabetes, you'd be referred to the hospital and be looked after by the hospital unless they discharge you back into the community. But what we heard was that patients were saying, we don't particularly want to have to go to the hospital unless it's absolutely necessary. We'd rather be treated closer to home in the community. But we do want that expert advice. And it's seeing the appropriate person at the appropriate time in the appropriate place. And so the question was, could we get treatment so that we would have specialist nurses, allied professionals, it's not just nurses, it could be podiatrists, it could be optometrists, even pharmacists or whatever, but supported by consultants, GPs, practice nurses in the community itself. And really the hospital was there for those who were really, really very severely ill, where it was clear that we would not be able to treat you in the community. That's what patients have wanted, that's what we also want, and as a GP it gives me great pleasure to see the kind of care that we're now doing. So the sort of example that I could give you is a pregnant lady in our practice who found out, diabetic lady who found out she was pregnant on a Friday at 4 o'clock in the afternoon. In the old model, she would have been referred into the hospital, she'd have been seen by a junior doctor and probably spent 3 or 4 days in the hospital until she's seen by a doctor and hoping that's a diabetic doctor. Whereas now, we can pick up the phone, speak to the diabetes service, which is what happened in this case. That particular patient was seen a couple of hours later by the diabetes nurse, changed over from tablets to insulin, seen on the Saturday and Sunday, and managed in the community, instead of having to be admitted into hospital and things. And that's just one example of the kind of care that we've seen. What we've also noticed is in the old service, there wasn't any psychological support. And one of the things that we're aware of is when you develop a long-term condition, it's not just the physical problem that you've got, the diabetes, the heart disease, or whatever it is, but often you might get depressed with that as well, because it can pull you down, it can make you feel unwell about it. And so with the new service that we've now got a psychological support. We've got a clinical psychologist who actually supports patients with diabetes who need that extra care, and that's something new that we've been able to add because we've been able to change the service. But in order to make this happen and in order to spread it, I'm now asking for you, because we need your help. We really do want you to try and start to work with us so that we can both start to build that future together, rather than me trying to fix you or you expecting us to do that. And the reason for that is because of this. Patients, carers and information are the most underutilised resources in the NHS. There are lots and lots of things that you are able to do and capable of doing if only you knew what it was that you can do. And if we can try and listen to you, learn from you, find out what things you want to do, what things you would like to do, then that would be great. But how do we actually do that? How would you find out, and how would we find out? Well, that's why the consulting room is incredibly important. As Alan said, you've got that relationship with your doctor and with your nurse. It might only be that 10 minutes. But during that 10 minutes, something happens. Clearly, there's a conversation between yourself and your doctor or nurse, and there's some kind of agreement made about what we're going to do and what you're going to do. We know from lots and lots of surveys that patients and the public trust their doctor and nurse more than anybody else at all. And over the 15 years, I've seen many, many patients who've listened to what we've said, I've listened to them, and they've gone away and they've started to do something different. So, what is that new thing going to be that I think could really transform the care for all of us over the next 3 to 5 years? And I think it's the internet. I think it's the ability. So if I just ask in this room, how many people have got access to the internet? Do you want to just put your hands up? Right, so I think it's probably like 95. Is there anyone in the room that doesn't have access to the internet? Right, so there's 3 people. Now I'm really pleased about that because I'm going to tell you the story. This week, I saw a patient. I spoke to a patient over the phone, elderly patient in his late 70s, and I asked him, have you got access to the internet? And he said, no. I said, okay, what about your family? He said, oh yes, my son does. Oh right, well we've got this service that allows you to go online and you can book appointments with the nurse, you can order repeat prescriptions, you can send secure messages, and you can access your records. And he goes, well, I haven't got the internet, but my son does. I said, oh right, so would you like to be able to access your records? I said, yes, how would I do that? And so I started to talk to him and I explained to him in a 10-minute consultation over the phone. In fact, he actually passed the phone over to his son and said, can you please speak to Dr Hannan and find out how I can get access to my records? His son turned around and said, oh yes, Dr Hannan, I've already got access to the records and I've got it for my children, it works really well. It would be great for my father to do so. And his father was saying, ask my son how to do it. So what can he do? 2 minutes. Well, 2 minutes, right. So what can he do? Oh, can you just forward it to the next? Once he's signed up for the service, he can see what problems he's got, he can see test results, he can see medications, he can see letters that have come back from the hospitals, scans, he can see consultations. So patients of mine who come in to see me, once they walk out the door and I hit the file button, they can go online, either over the internet or using a smartphone or using a tablet to be able to see what we've discussed. What that means is when they go home and they don't quite understand anything, they can ask their partner, they can ask their children. I've got patients whose family might be over in Australia or America or Canada or the Far East, and because they've been given the passwords, they can keep an eye on their parents. So even though you might not have access to your records, it's possible that you might have a family member who you're happy who can keep an eye on things. If we just go to the next slide, please. And this is just showing you how you can even do it on a mobile phone. It doesn't have to be the internet, so you can see screenshots of what that looks like. And if you go to the next slide. And what we've learned is we've been offering this service for 10 years, but patients have started to learn what health means for them. Health is not just the absence of disease. Health is about your social, psychological and physical well-being. Our patients, our patient participation group, are any members of, I know there's one member of patient participation group, are there any other members of patient participation groups here? So we've got a couple. We've got a very active patient participation group and they've set up something called Health Pledge. And it's an opportunity for everyone to pledge something that they can do that can make a difference for their health. It might be just drink a glass of water, it might be walk to the bus stop or whatever it might be. But something simple that you can do that can make a difference. If you just go to the next slide, Peter. And next week we've got Self-Care Week, and it's a big national campaign to try and raise awareness of things that we can all do to improve our self-care. Our PPG is going to be doing something in Morrison's with Manchester Metropolitan University. The the student nurses are going to be coming over to talk to the public about things like your blood pressure, your weight, smoking, alcohol and other issues. And it's an opportunity to learn. And it's about us going out to where the people are, rather than expecting people to come to us. Next slide, please. So finally, what do I think are the 6 Ps for success for all of us? And patients and the public, partnership of trust, this relationship that exists between patient and clinician, the paradigm shift in healthcare, which is about how the IT starts to change things, and finally, let's get started because practice makes perfect. Thank you very much.